There's a lot that can be done outside of the package that is already being discussed and is on the table, including by DG HERA, that looks at alternative incentive models. What can be done, it's an interesting question, because I think what can be done within the pharmaceutical package is perhaps limited, and I think that that's actually not necessarily a problem. I know that there's a big focus on the need to include something in the pharmaceutical package, but I think it's much more important that we get something that works, that is effective. So I think the pharmaceutical legislation proposal is not necessarily where we're going to solve this problem. The transferable exclusivity voucher is not going to get us where we need to be, and I think it's important that we actually consider the alternatives that are also on the table, including in DG HERA. There's a little bit of tendency to sort of think that the pharmaceutical, if it's not in the pharmaceutical package, then we won't be able to solve it, and I think that's a false narrative. I think we have to consider what outcomes we want to have, which is getting sustainable access to effective antibiotics for everyone, and we have to find the most appropriate way of designing incentives and placing them where they then need to sit, instead of thinking that it has to sit in the pharmaceutical legislation package.